Hi, so today I would like to talk a bit about trazodone. Trazodone actually is the generic name for this medication. I think the brand name in the US is Desirel, but you're not going to hear that. Pretty much, this is a medication that goes by its generic name, and that's trazodone. So, trazodone was originally approved and marketed as an antidepressant, but these days, and for a long time, it's pretty much used exclusively as a sleep aid. And I have not frequently prescribed it as an antidepressant. There's a lot of options that we have to treat depression, and trazodone just has a reputation of not being a particularly effective antidepressant. I don't know if that's a fair characterization, but that's just the reputation that it has. And as I said, it's pretty much used exclusively as a sleep aid. So the dose range that we actually use, the dose range I think can go much higher, but pretty much we use it, starting at 25 milligrams, and then all the way up to about 150 or 200 milligrams. I've seen people on higher doses, even just for sleep, but generally, so the main problem with trazodone as a sleep aid is that it can overshoot and still be in your system in the morning. So it can cause a hangover or grogginess in the early part of the day. So that's what tends to limit the dosing for some people. But the thing to keep in mind with trazodone and with all medications is that just because there's a common effect for most people, it doesn't necessarily dictate exactly what you or any particular individual is going to experience. So as I said, I have one patient I can think of who's on 300 milligrams of trazodone, and that's just what she needs to really facilitate sleep, and she doesn't have any problems with grogginess in the morning. And then I have other patients where even at 50 milligrams they just find it a little bit too much, and in that they're groggy in the morning, and after a while sometimes the 50 milligrams doesn't even help them fall asleep that easily. People can develop a bit of a tolerance to it, but it varies across the board. I like having trazodone as an option because it works great for some people, really just puts them right to sleep, and they have a nice sound sleep and they don't have any issues with grogginess. So that's what we want out of a sleep medication. And for some people that's true. Other people, they really don't like it at all. They just find it makes them too groggy right from the get-go. Or for others, it just doesn't work as well. And we do have other options to use for sleep. In terms of coming off of the medication, depends on what dose you're on. I like to taper any medication. So, if you are taking 100 milligrams and you want to try to come off of it, I will generally advise that you take a lower dose for some time, maybe a week. We cater it to each particular patient, and then the main kind of side effect of coming off any sleep aid is that you won't sleep as well. It's fine to tolerate that initially because your body's going to kind of get used to not having sort of something that signals sleep by taking a sleeping pill. But there shouldn't be any significant physical withdrawal coming off of trazodone. And common side effects, it's basically what I kept alluding to, which is that you can get this kind of hangover in the morning, and that's the main thing you have to grapple with. One other rare side effect to keep in mind with trazodone is something only men have to be concerned about. It's something called priapism, which is a sustained erection. It's not very common, but it is something that is associated with trazodone and something to be aware of and just to mention when prescribing it. Because if it does happen, it's very important that that individual go to the emergency room and get treatment right away, because you can have long-term damage to erectile function if the sustained erection is not addressed appropriately. So it's very, very rare. I have had one patient in my practice who developed it. They knew what it was right away. They got it treated. There was no long-term effects of it. We just avoided trazodone in that patient, as you should do with any patient who develops this very unusual side effect. But it's worth being aware of. So I mentioned it, but it's not at all common, and not, I think, a reason not to consider using trazodone. I think it's a good option for sleep, and that's it. Thanks.